Dr. Amy Cantor at OHSU says it's not enough for women to go to the doctor when they're in pain. She says you've got to go before there's an issue and get regular checkups. It's called preventive care.
It's important that women understand that access to preventive services and understanding preventive services can help them detect diseases early, screen for conditions.
She says those conditions are mostly determined by a woman's age, risk factors, and exposure.
When you're coming to your doctor and you're in your 20s, there are certain services that you're eligible for, such as screening for cervical cancer, screening for sexually transmitted infection.
As women get older, there are certain screenings that are important depending on your decade of life.
Lots of women have questions about breast cancer screening, about screening for osteoporosis and bone disease, about screening for colon cancer. These are all important to ask for women to ask their doctors about.
Regardless of your age, women can get those screenings without paying anything out of pocket.
When I mean eligible, they're covered under the Affordable Care Act. Women can go on websites such as healthcare.gov or the womenspreventivecare.org to look at the types of services that they're eligible for.
Dr. Cantor says while it's important for everyone to get preventive care, some women face barriers to health care.
There are huge disparities in the health outcomes for different women. We see this in the maternal mortality crisis. We see this in rates of cancer treatment and access to services.
She says it doesn't matter your age, race, or socioeconomic status. All women should have the opportunity to get the care they need.
Women are healthier, they thrive, and everyone thrives. And it's really important that we are all looking to achieve health for all women across the lifespan in an equitable way.
Deidre Johnson, KGW News.